Namaste dear students. In this module on how to find a research question and select appropriate methodology to conduct the research project will be dealt with. I'll be talking to you for 5 lectures in this series. The first one is about general understanding of research. The title is Know-how of Research. Let's begin. Learning objectives of this research are purpose of research, philosophies of Ayurvedic and modern research in brief, definition of research, research process broad and general, important terms, finding a research question, and approaches to address the research question. What is research? It is identification and definition of a problem. Once you identify and define the problem area, you formulate the hypothesis. Then comes collection, organization, and analysis of data. After analyzing, we come to conclusions. These conclusions lead us to verification of hypothesis and also to identification of a new problem. So research is a consistent activity. It is also highly intellectual and creative activity. Why to do research? You know, there are various problems which demand solutions. In today's era, at the moment, we are facing the problem of COVID-19 disease caused by 𝐴𝐴 virus. There are multiple problems at different levels of clinical practice or laboratory work. Acquisition of new knowledge, contemporary development to sort out the problems for the benefit of self and also of the mankind is the prime objective of research. Research also changes you. When you are a BAMS student, you are equipped with the basic knowledge and set protocols to treat patients, to teach, to do various activities related to health of human beings. But when you enter into your master's programs, doctoral programs, postdoctoral fellowships, or you join in an organization as a research fellow, then the research changes you. It inculcates critical thinking ability. So the same you, following a particular standard protocol sitting in a clinic, starts thinking about unsolved problems of the patient. It also develops regular sharing information habit into you. You start looking for people who are working or interested in the area similar to yours, and you start building up your network. The scientific attitude starts to develop. Research adds to the existing knowledge and opens up new vistas in your subject. Insights regarding the worldview of your core area increases. Research inculcates sense of ethical and moral responsibility towards society. And as you are aware, philosophically, we follow the concept of 4 runas: Devaruna, Pitruruna, Samajaruna, and Guru Runa. Research is one of the best ways to clear your debts in this sense. As rightly said in Charaka Samhita Vimansthan chapter 3, reputation of any applied branch of science grows with the number and quality of highly educated people in that branch. So more and more students should take up research. Ultimately, it also gives satisfaction of carrying forward the legacy of mentors on the path of salvation. So that's what research gives you, and research changes you. Let us look into these two terms, search and research. Search is of truth. Truth is true knowledge. It is also the relationship between cause and its effect, which we know as Karya-Karana Bhav. Through search, the basic principles evolve. Research is to find them once again or confirm those principles in the new setting, new era, changed socio-cultural and economic atmosphere, and also with changed perspective. Research is also an exploration of different approach to uncover truth or to discover new things. Truth never changes, so are the Siddhantas, and thus both are Shashvat. But perspective to reach the truth always changes, and hence research is contemporary. I hope that I have clarified the doubt in the minds of many bright young students that though Ayurveda is the huge repository of knowledge, why we should do research. We should do research to contemporize Ayurveda in ever-changing world. So the development of research methodology is very interesting. There are two things, opinion and fact. Opinions are based on feelings and the perceptions can change. But facts are based on proofs and logic. They cannot change with perception. Let me give you an example. Sachin Tendulkar, while playing on the cricket field, should bat in this way. Oh, he should have given this stroke. I like him very much. This is my feeling and opinion about Sachin. When he doesn't do a century, I feel, oh, why he has not done the century. His game is downgrading. This is the perception. What are the facts? He is the best square dry person. He has done so many records. These are the facts. They are based on proofs. They doesn't change whether I like his game in a particular match or a series or I don't like it. So facts remain constant. They cannot change with perception. That's why the research methods are systematic approach with detailed observation using 5 senses and then drawing conclusions about anything rather than opinion and fact. Here you will also find similarity in Eastern and Western traditional philosophy. The Westerners have 2 approaches, dogmatic and pragmatic. The dogmatic approach goes with the church, priest, God, and there are set things. You have to follow this ritual in this particular way. Whereas the practical validity of looking at a thing or doing a particular thing in a particular way is different. Similarly, Easterners also have 2 views, Vedic, that is theist, and Avedic, that is atheist. Nyaya, Vaisheshika, Sankhya, Yoga, Vedanta, that is Purva Mimamsa and Uttar Mimamsa. Also, the Charvak, Jain and Buddha, these are the 9 darshanas which give us a huge foundation to develop research methods for research. The basic theories which were used and which are named as Pratitantra Siddhanta by Ayurveda are the theories of Padartha Vidya. They have been adopted from all these darshanas. The science of Panchamahabhuta, the Anyonya Anupravesh theory, Sapta Padarthas giving dimensions of time, direction, which are used in Dhatu Pariposhan Kram, which are used in chronopharmacology, which are used in Dosha Chaya Prakopa Prashama, which are used in Dinacharya, Rutucharya, the time of administration of medicines, the transformation of various ahara as well as aushadhi which we are taking in for anuvritti of ayu or for treatment of diseases. So there are these sets of theories which we must revisit when you take admission to the research methodology course. Similar to Ayurveda, in modern science, after 1600 AD, there is a development in the basic sciences. Physics, chemistry, biology are the basic sciences, and there are various mixed approaches emerging out of these basic sciences like biochemistry, biophysics, molecular biology. We talk about the genetic theory of diseases. We know various types of energies and their interplay. We know motion as a function of movement. So there are in both the sciences there are various theories which we need to apply when we take up a research project and then try to understand the cause and effect relationship. At this point, I cannot deter myself from taking you to the 2 big names, personalities, PLUTO and ANNAMBHATTA. PLUTO is the father philosopher of research from the Western science, and whereas I put ANNAMBHATTA as the father and philosopher of research methodology for Ayurveda. PLUTO gave us a syllogism: all men are mortal, you are a man, and therefore you are mortal. This is the logical approach to find out cause and effect relationship. And here ANNAMBHATTA gives us Sahacharya Niyama Vyapti. He says, Yatra yatra dhumaha tatra tatra vannihi, mahanase dhumaha, it means mahanase vannihi. So you find wherever there is smoke, there has to be fire. You see smoke coming out from the kitchen chimney. That means in the kitchen, vanni, fire is there. This also is the logical approach, and this approach leads or is the basis of research. In the paradigm of research, we find 2 distinct methods: inductive method and deductive method. In the inductive method, we come across data first. Like right now, we are getting various results of various researches about COVID-19 at the moment. People are observing, lots of observations are there. There are hypotheses like what drug can be used to fight this virus. There are previous antiviral drugs which are being tried and tested. Theories are being built, and then people will come out with some conclusion or solution, and if a vaccine is found, then it would be the discovery for this particular disease. So, inductive method is based on data, observations. From that it generates hypothesis. It tests the hypothesis. Theory is built upon that, and then the hypothesis or then the generalization happens. This type of approach has a limitation because generally this is a guesswork and it is unable to give method to show the cause and effect relationship. Other method is deductive method. It starts from an abstract idea. That abstract idea with the prior knowledge develops a theory. From that a hypothesis is generated. Based on the hypothesis, guided by the hypothesis, data is collected, analyzed, which tests the hypothesis, and we confirm the cause and effect relationship. In this particular approach, the limitation is it remains unidirectional. With this background, the research is defined in today's era as it is a systematic, controlled, empirical and critical investigation of a natural phenomenon guided by theory and hypothesis about the presumed relationship amongst the causes and outcomes of the phenomenon. This definition allows us to go back to the 𝐻𝐸 philosophy of Ayurveda, which has been adopted by Ayurveda and which talks about Karya-Karana Bhava Siddhanta, Satkaryavad, and I quote, Karanam nama tad yat karoti 𝐿 hetuhu sakarta tatra karananurupam karyam iti. With this much philosophical tenets, let's move forward to understand the thought process of research. It depends on 5 questions: what, why, how, who, and when. So, what means the problem or issue under exploration? Why? We have to have reasons for the exploration which leads to hypothesis and subsequently aim and objectives. How means the method of conduction. In other terms, it is materials and methodology. Expected outcome with power of study. Who does this? A researcher. If you are a student of master's or PhD, you with your guide, with your associate colleagues and friends, you do this research. If you are working in a research organization, then your team and your co-workers are doing this research. When to do it? There are always predicted timelines to do a research project. For a project in the extramural category, for funding and budgetary projects, generally the timelines from 1 to 3 years are given. And in times like COVID-19, you have to do or you have to finish the work within 6 months to 1 year. So this is the basic thought process of research, which gets converted into introduction, aim objectives, material methodologies, results discussion conclusions in a research project. Let's see components of the research project. It is also known as protocol. There are two different aspects when you conduct a research, and I feel that students should be well aware about these two aspects. The first aspect, to which any student and any professor is well acquainted, or any research fellow and his mentor is well acquainted, is the technical intellectual input. We are masters in our subjects, areas, so we know the problems, the issues which we face in our area. So selection of area or topic, the need for this particular research, prior knowledge about that topic, the gaps which we have identified over time, we all are well acquainted with all of this. The technical input or the technical proposal must have materials methodology, method of data analysis, proposed interim publication, final report, dissertation or thesis. All these things, they fall under the category of technical input. There is other aspect or other component of a research project, and our students are less acquainted with this aspect. That's called research administration. Research administration demands data management, fund management, time management, and human management. Without these four, you cannot do a research project, may it be a MD dissertation or a completely new funded research project of which you are a principal investigator. Let's see the fractions of these four areas. Data management essentially starts with fractionizing your work. There are various tasks, like if you want to prepare a medicine and see its effect in the disease diabetes, then your work will be divided into 3 or 4 major tasks. Sourcing of the medicines, making of the medicine, dispensing the medicine to your selected group, and there are various other tasks like taking the permissions of ethics committee, preparation of informed consent, and so on. This was an example for clinical research. In literary research also, there are so many such tasks which you have to identify and fractionate. Based on the task, data will come in from various sources, and then you have to put it together and convert it into a meaningful publication and final report. The second component is of fund management. You need to do budget for your research, and you have to identify different components of budget. You have to know how to utilize, how much to utilize, when to utilize a particular budget for your particular amount for your research work, and then preparation of monthly balance sheet, which will finally give you the total cost involved in your research project. The third component is of time management. Even if you are working as a MD student and you have to complete your MD dissertation in 3 years' time, you have to have a task schedule. So after your admission, you have to submit your research proposal or outline of your research work to the institutional review board or institutional scientific committee. After that, you get a sanction, your research title is approved, then you start working on your research project, and before completion of your final, before appearing to your final degree examination, you have to complete and submit your dissertation to the university. So all this is tightly time bound. For a master's degree, you work for 3 years. For a PhD, you might work for 3 to 4 years. If you are in a research organization, there are particular time schedules given to complete the tasks, and therefore you have to make a PERT chart for this. Chart of task against time, which is called PERT chart. And you also have to do human management, which is most important. When you are working on any research project, there are various committees you have to face. There could be ethics committee, there could be institutional review board, there could be a scientific committee, there can be, there are various people involved in your research. There could be your friends, your department, faculty members, your own guide, and you have to work with all of them. So you learn networking skills, and this is the way you enter into the development of your professional achievements. So considering all these components, when you prepare a document, it is called research protocol. It could be for submission to a funding agency, it could be for submission to the institutional review board. So a protocol is prepared considering all these factors. There are various terminologies which you must acquaint yourself with. Phenomena, variables, paradigm of research, rigor, statistical methods, endpoints, and so on. You will get all these terminologies from different research books. Coming to the most important part, where to find the research question. You can see here this small, tiny, yellow flying object. It's flying here and there, and everyone in this crowd is searching for that object. That's nothing but a research question. Research question is everywhere in and around you. Let me take you to the scenario. In a clinic, you prescribe ANNAMBHATTA capsule 400 milligram, and the patient reports that he experiences acidity after he consumes that capsule. He calls you and he tells you that after 3 days of taking the medicine. After you receive this phone call, you come up with various questions. Is he the first patient who suffered from ANNAMBHATTA? Did I misdiagnose his Prakriti? Are there any references in text, or there are some published reports? Was the ANNAMBHATTA of right quality? Was the dose and anupan correct? Can I find out the reason by using some tests? Can there be some other patients who suffer but do not report? Can I trace them, and how? These are the questions which might take you to a prospective open trial of finding out side effect of the most revered and important drug from Ayurveda repertory, ANNAMBHATTA. Let's take another example. I'm working with a group of patients with joint disorders. they have been advised to take Snehan, Svedan and Basti. After 2 weeks of treatment, a few of the patients tell me that they are simultaneously taking physiotherapy sessions. Now, another set of questions come to my mind. Is Snehan, Svedan, Basti better than physiotherapy? If a person is taking both, what should be the gap between the two procedures? The patients taking both the treatments recover earlier than the ones taking either? Patients taking only physiotherapy recover within the same time limit as that of Panchakarma? Do the treatments complement each other or there are some side effects? Are both treatments cost effective together? There could be some more questions. So, I feel that the research questions are everywhere, in and around you. Wherever in your department you are talking with your friends, talking to your teachers, talking to your colleagues who are your friends, you see some cases, you see some patients, you see something different, you observe something not fitting in your standard protocol. That's the research question. Once you find your research question, the next important step is to approach the question. Depending on the situation around you, you can approach the question in a literary way, observational way, or there could be experimental or clinical method. If you want to do a literary research, you can do critical evaluation of a text pertaining to your research question. There is one more aspect of literary research, and that's manuscript evaluation to make a critical edition of a text. All the texts which we study now, like Yoga Ratnakar, Rasahridaya Tantra, Charak Samhita, they are the critical editions made after studying maybe 6, 7, 10, 12 manuscripts, handwritten manuscripts available from the ancient times. So literary research is a vast area in itself, which we will deal with in some of the next lecture. Observational research has two components: descriptive inferential research or epidemiological research. The most well-known research methods in Western world or biomedical research are the experimental research and clinical research. For Ayurvedic students, the first two methods or approaches, literary research and observational research, are equally important. So how to go about research? In any of these types or paradigms, literary, observational, experimental or clinical, it is important to have a hypothesis, to identify variables, to know the type of method, whether it is qualitative or quantitative or mix, to know the exact design, know the endpoints, and make the study protocol are important. So in the next lecture, we will see one by one how to select appropriate method for a research question. Thank you very much for listening patiently to this first lecture. Thanks and see you soon.